This is Chris. He's my patient volunteer, and I have taken his vitals, checked his height and weight, and checked his vision before his exam today. So Chris, first thing I'm going to check on you is just take a look at your skin and your hands. And the skin's nice and warm and dry. Brisk cap refill. Fingernails look normal. Everything looks good there. Next thing I'm going to do is just look at your head. You can just relax. Just going to inspect, look at the hair pattern, notice any abnormalities. Just going to palpate his cranium and scalp. Any pain or anything with that?
No.
Good. Next thing I'm going to do is his face. I'm just going to inspect the overall symmetry of his face, noting any problems with any abnormalities there. I'm going to palpate his frontal sinuses. Any pain with that?
No.
And his maxillary sinuses. Any pain with that?
No.
Good. I'm going to check cranial nerve 7, which is your facial nerve. And I want you to puff out your cheeks. And don't let me push. Good. And just wrinkle up your brow like that. Good. So cranial nerve 7 is intact. Next thing I want to do is look at his eyes. I'm gonna first check his cranial nerve 2, which is a confrontation test. Can you just hold this piece of paper over one eye for me? And I want you to tell me when you see my finger come in.
Oh. Yep. Yep.
Okay. And cover that eye.
Yep. Yep. Yep.
Good. So that's cranial nerve 2, the optic nerve. Next thing I want to check is his cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducens. So I just want you to follow my finger and don't move your head, just your eyes. Good. That's good. That's all intact. Next thing I want to do, I would darken the room for his eye exam, but we're not going to do that for the sake of the video. Just look straight ahead, look at that picture over my shoulder. Good. Good. And pupils are equal, round, and reactive. And just follow my pen all the way in. Good. In accommodation. The next thing we want to do is an exam of his retina. So Chris, I just want you to pick a point on the wall again behind me, and again I would have the room dark for this exam, and I'm just going to take a look at your retina. So I'm looking at the red reflex. Good. And I'm looking at the macula, the vessels, the optic disc, the retinal field, and that all looks healthy and normal. And I would of course do the other eye as well. Next I'm going to look at your ears. Any problems with your ears that you've been noticing at all?
No.
Okay. Just visually inspect the ears. One thing I did forget is just a visual inspection of the eye. I didn't say that. I would look at his conjunctiva, sclera, iris, pupils, all that looks normal. So an inspection of his ears, I would just look at the outside of his ears. I'm going to palpate his auricles and his tragus. Any pain with that?
No.
Okay. That all looks normal. His auditory canal looks normal. And take a peek inside your ear here. And I can see the auditory canal looks clear. The tympanic membrane looks intact, pearly gray. Malleus was also visualized. Cone of light was also there, so that all looks normal. I'm going to come back here and test cranial nerve 8. So can you cover up this ear for me? Okay. And I'm going to whisper a word, and I want you to tell me what I say. Basketball.
Basketball.
Okay. And the other ear?
Denver Broncos.
Okay, good. Pulling back here, Chris, I'm going to go ahead and check your thyroid. Do you have a bottle of water?
Yes, I do.
Okay, just gonna Take a drink when I ask you to, okay? Just relax. Okay, go ahead and take a drink. Okay, that all feels normal. Let me back over there. Next thing I'm going to check is your nose. So just look up for me. Any problems that you're noticing breathing through your nose?
No.
Can you cover up one nostril and breathe through? Okay, and the other side? Good. Okay. Just gonna take a look here. I know the turbinates are present. Mucous membranes are nice and pink and moist. Next thing I want to check is your mouth. So can you open up your mouth real wide for me? Okay. And the mucous membranes are nice and pink and moist. Can you say ah?
Ah.
Okay. So that all looks good. I'm checking cranial nerve 9, which is the glossopharyngeal nerve, which the uvula contracts, so that's normal. We'll not make him do a gag test today, which would be a vagus nerve, cranial nerve 10. And can you stick your tongue straight out for me? Good. And that is cranial nerve 11, which is the hypoglossal nerve, and that all looks good. So we've done head, face, eyes, ears, nose, and throat. I'm gonna start your neck. So just relax. First thing I'm gonna do is just inspect it. I see your trachea here, looks nice and midline. Any pain or anything that you're noticing with your neck?
No.
Okay. While I'm here, I'm gonna go ahead and check your carotid pulses. I'm gonna go ahead and listen for any bruits. Take a deep breath in and exhale for me. Just exhale. Okay, and again. Good. Okay, next thing I want to do is just palpate your lymph nodes around your neck. I just want you to tell me if you have any pain at all. We'll start with your postauricular, preauricular, submandibular, submental, tonsillar, posterior cervical, superficial cervical, turn your head that way, deep cervical chain, this way, good, infraclavicular and supraclavicular. Any pain with any of those?
No.
Good. One more thing, I want you to shrug your shoulders up for me and down. Good, so that's spinal, that's cranial nerve 11, which is spinal accessory muscle, and that is intact. So Chris, we have checked your head, ears, eyes, nose, throat, neck, and we're gonna move to your posterior chest. So can you, I know it's kind of uncomfortable for the sake of our video, can you straddle that chair for me? And Abby, you might wanna get over here. All right, first thing I'm gonna do is just inspect his chest. It looks nice, the skin's intact, don't notice any abnormalities. All looks normal. So the first thing I wanna do, Chris, is I'm gonna just relax your arms. And I want you to repeat the phrase 99 every time you feel me move my hands.
99, 99, 99, 99.
Okay, that's good. And I'm gonna go ahead and percuss your lung fields, okay? So just relax. Good. Next thing I'm gonna do is take a listen to you. So every time you feel me move my stethoscope, I just want you to take a nice normal breath in and out, okay? Next thing I want to do, I'm going to have you say the letter E every time you feel me move my stethoscope, okay?
E, E,
last thing I want you to do back here is I want you to just whisper the phrase 1, 2, 3,
Okay.
and whisper every time I move my stethoscope. Okay, and the last thing back here is just gonna check see if you have any CVA tenderness. So just let me know if this hurts at all. Any pain with that? Okay. So I think we're done with that. And while you get turned back around here, I'm just gonna take a quick peek at my card. You can have a seat back down there. Okay, I'm gonna have you go ahead and move your neck all around for me. Good. And just push against my, don't let me push this back, push, and again. Okay, and back and forwards, good, okay. I'm gonna go ahead and listen to the front of your chest now. First I'm gonna inspect your chest, don't notice any abnormalities there, skin looks nice and intact. First I'm gonna percuss. Good. You don't have any pain with any palpation? Okay. I'm gonna take a listen. Just take a deep breath in and out. Sitting here, I'm going to just check your upper arms. I'm going to feel your axillary lymph nodes. Just move your arms out a little bit. Okay. And at the cochlear lymph nodes, just relax your arms. Okay. Just hold your arms out like that and don't let me push down. Okay. And don't let me push you up. Good. And just move your wrists for me. Out and in. And can you touch your shoulders this way? And this way. Good. Any pain with any of that?
No.
Okay. All right. So I'm going to go ahead and just listen before you lay down to your aortic and pulmonic valves. Lean forward just a little bit for me. Aortic. Take a deep breath and exhale. And pulmonic. Okay. Don't hear any clicks or murmurs. All right, I'm gonna have you lay down there, Chris. There's all my stuff. Okay, go ahead and lay down there. All right. Okay, so I'm gonna inspect his precordium. Not noticing any heaves or anything like that, just visually looking. Skin looks nice and dry and intact. I'm gonna just palpate his chest down here. I'm gonna feel for his apical impulse. Good. And I'm just gonna take a listen to your heart, so just breathe normally. This is the aortic, which is the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herb's point, left intercostal space. I'm sorry, left sternal border, third intercostal space. Tricuspid, fourth intercostal space, left sternal border, and the mitral, fifth intercostal space, nucleolar line. And I would listen to his apical for a full minute. But for the sake of time, I'll keep going. I'm gonna just palpate, also take some vascular sounds. Just gonna listen to your aorta. And renals. And iliacs. Good. All right, so the next thing I'm gonna do is just listen to your bowel sounds. Good. That sounds good. Just gonna percuss on your belly. Just let me know if it is uncomfortable at all. Good. Next thing I want to do is just push around on your belly a little bit. So let me know if it is uncomfortable at all. It's just some light palpation. And a little bit deeper palpation. Let me know if you have any pain. Okay. I'm gonna palpate for the liver and the right kidney and your spleen and your left kidney. Next thing I'm gonna do is just measure your liver span here, so again. Okay, I'm gonna mark that there. And go from the belly. We'll measure that to be about 7 centimeters, which is normal. Let's see. Next thing I'm gonna do is just have you move your legs for me. So I'm just gonna have you adduct, good. And your knee, good. Get your ankle around for me. And your toes. This hip. Okay. And okay. Move your ankle around for me and your toes, okay? And check your popliteal pulses. And your posterior tips. And your dorsalis pedis. Good. I think that's it for laying down, but I'm gonna look at my card one more time, so hang tight. Don't notice any edema in the legs, and I was also just palpating for any abnormalities of his lower extremities, and I did not feel any. So Chris, we're gonna have you get back up in the chair. And I'll do a couple other tests with you. Get stuff ready here. All right. So we're going to check the sensory function of your cranial nerve 7, the trigeminal nerve. Just want you to tell me when you feel this, okay? Just close your eyes.
Yeah.
That's the ophthalmic.
Yeah.
Maxillary.
Yeah.
And then mandibular. Good. I want you to Move your hands over quickly for me. Okay, like on your lap. Good. And can you slide your heel from your shin to your knee? Good. Awesome. Next thing I want to do is put something in your hand, and I want you to tell me what it is. So close your eyes. Hold your hand out. Don't look. Close it. Can you tell me what that is?
Q-tip.
Good. And one more thing to check. Can you tell me what this is? Close your eyes.
Cord.
Yep, good job. Can you walk across the room for me? Good, and come back. All right, and can you do a shallow knee bend for me? Okay, and can you turn towards there and bend over and touch your toes? Good, and just hold it there for me, sorry. That all looks nice and straight. I don't see any signs of any scoliosis. Stand back up for me and do some range of motion of your back. Just lean forward and back, side to side. Good. That's all good. Good. Have a seat again. And I think I'm about done. I'm going to look at my cord for the last time to make sure I didn't miss anything. I'm not done your deep chin reflexes yet. We're going to do the upper extremities first. Just let your arm hang loose there. Relax. And just, there you go, just completely relax. Okay. And we'll do your, scoot back in the chair a little bit and let your leg dangle. We'll do your patellar. And we'll do your Achilles. Okay. Can you stand up for me and just close your eyes? Just close your eyes and stand there. This is a Romberg test to make sure that you are able to stand there without swaying or falling over. That's good. Okay. Sit back down. And I'm just going to touch you with something sharp or something soft. And I want you to tell me what I'm touching you with. So close your eyes. Just hold your arm out for me. Is that sharp or soft?
Sharp.
Okay. And this one?
Soft.
Okay. Don't let the guinea.
Sharp. Soft.
Okay. And hold your hand out for me with your eyes closed. I want you to tell me if I'm moving your finger up or down.
Down.
Okay. I think that concludes our exam today. Chris, thank you for volunteering to be my patient. Thank you.